Okay, thanks everyone for being here. I think we'll go ahead and get started. My name is Kim Hazard. I'm a senior environmental scientist with the Safer Consumer Products Program, or SCP, here at the California Department of Toxic Substances Control, or DTSC. I had the pleasure of coordinating some parts of this project and including today's event. And so you'll be seeing me pop up throughout the event today. Um, Again, if you're just joining us, feel free to put your name and affiliation in the chat. We will have the chat enabled during the first half of the meeting, but folks will be muted. And we'll have lots of opportunity for discussion in the breakout rooms. We also have the Q&A enabled if you want to ask clarifying questions throughout the presentation. We will monitor that and have time for some clarifying questions between presentations. Thanks so much for being here. We know that your time is valuable, and we're really grateful that you've chosen to spend it with us here today. Please note that we are recording the first half of the meeting, and we won't be recording in the breakout rooms. We will have note takers, and we encourage that time for active participation. So first up, I'm going to pass it over to Jen Jackson and Megan Arnett for some welcome remarks from the leaders of today's co-hosting organization. So Jen, I will pass it over to you.
Thank you, Kim. Can you hear me okay?
Yes.
Hopefully.
Sounds
great.
good.
Thanks. Hello and welcome, everyone. We are so delighted by the interest in this roundtable. It speaks volumes to the deep commitment that so many of us share. We want to thank you so much for joining. My name is Jen Jackson. I'm one of 3 program managers at the Safer Consumer Products Program, which we'll call SCP throughout the day. Today, we're going to hear a lot about different ideas for embedding environmental justice considerations into alternatives assessment. So hopefully you all are in the right room. I want to acknowledge that the national conversation about environmental justice today looks very different than it did at the beginning of this project. The environmental justice arm of the U.S. Environmental Protection Agency has been eliminated, along with critical funding for research and implementation. But nothing has changed here at the Department of Toxic Substances Control. We remain committed to environmental justice, and SCP is actively working to embed environmental justice considerations across all parts of our program, not just the alternatives assessment or analysis process. We're very grateful that we have been able to maintain the project funding from the grant from the U.S. Environmental Protection Agency through to its end. And so that funding is part of what you're seeing today, the outcomes of much research and lots of conversations with experts. We maintain that communities most impacted by polluting facilities and harmful chemicals and consumer products are the experts in their needs and the harms they face. And so we thank those of you here in the room for working together with us to consider how best to acknowledge those harms and consider how to conduct alternatives assessments to ensure that those are addressed. I want to thank the SCP team who's been leading this work: Michelle Romero, Alicia Lim, Heather Lee, Kelly Grant, Kim Hazard, who has been the project manager, and Xiaoying Xu, the supervisor. And I want to thank all of the contractors and interview participants and volunteers helping today, and all who are here. So thank you very much. And I will pass it to Megan Arnett from the UC Berkeley Center for Green Chemistry.
There we go. Sorry, I missed the mute button the first time. Hi, everyone. Good morning, Old Pacific Coast. Good morning, and welcome. Thank you. I just want to echo Jen's sentiment. Thank you so much for giving us your time this morning, and for committing to this learning about environmental justice in this context and how we can measure its impact in this way. I'm Megan Arnett. I'm the Executive Director of the Berkeley Center for Green Chemistry, which is an interdisciplinary green chemistry center located at UC Berkeley. As I said, I'm really excited to share the work that has been done over the past year in this really, I think, pretty unique collaboration between BCGC and the Department of Toxic Substance Control. Each of us comes to this work with a different lens, but there's a shared goal here that you will hear a lot about, which is advancing safer chemistries that not only protect the average consumer, but also prioritize those communities that bear the greatest burden of chemical exposures. At the Berkeley Center for Green Chemistry, we've been assessing alternatives in the classroom and in collaboration with industry for over a decade through internships and research and our Greener Solutions course. In this course, interdisciplinary student teams partner with industry leaders to tackle these real-world chemical challenges. One of the case studies you'll hear about today actually started as a Greener Solutions project. And I love that this showcases how these types of academic, industry, and government partnerships really can spark solutions and ideas that ripple out into practice and into policy. The Department of Toxic Substance Control, as you will hear about today, if you are not already aware, is committed to really embedding these lessons into their regulatory and scientific practice. And as Jen mentioned, in the absence of strong federal drivers and regulation, we really look to forward-thinking businesses and innovators to lead the way here. And the methods you will hear about today are shaping tools and frameworks that those industry leaders will need in order to do that. This work will not only inform DTSC's approach, but will also help us train the next generation of practitioners that come through the Berkeley Center for Green Chemistry, whether incorporating this into the types of alternatives assessments that we do, chemical hazard assessment, green chemistry design thinking. These will all ensure that environmental justice is a core value and continues to be a core value in creating safer products. So as you listen to this presentation today, I hope you can think about not only the immediate applications for your own work, but also the long-term impact, how businesses can innovate responsibly and regulators have better tools. And in doing so, we can better protect our communities.
Thank you, Megan. And thank you, Jen, for the warm welcome. My name is Michelle Romero, and I will be providing a brief introduction to our session today. And I just want to give everyone a glimpse of what we have prepared for today. As I mentioned, I will just cover a little bit of basics. And for some of you who may not be entirely familiar with our program, we're just going to cover what alternatives assessment looks like for SEP. After a couple of presentations from Molly Jacobs and Grace Campbell, we will have a break at about 10:20 in the morning. And then when we come back, we will have 2 rounds of 30-minute discussion rooms that we have prepared for everyone. And we will be, or we are expecting to wrap up at about noon Pacific time, 3 p.m. for those of you in the East Coast. And we know that alternatives assessments are meant to identify safer alternatives. And this begs the question of safer for whom? We know that toxic chemicals affect communities that are already historically impacted, including low-wealth communities and people of color. This contributes to health disease such as higher rates of asthma, cancer, and reproductive problems. Excuse me. The way we conduct alternatives assessments might make a difference. However, there is no established approach for considering environmental justice throughout that process. We urgently need to work on the development of tools and methods for business and government decision makers to evaluate the impacts in a product's life cycle to avoid inappropriate burden shifts and possible regrettable substitutions. Today, we pose a question to all of us on how we can make it not only explicit, but systematic to better protect overburdened populations through AA. And with this in mind, let's pause and think about who's in here in the webinar. And if you don't mind, can you raise your hand if you work for academia? You can react by clicking on the reactions button or press Ctrl-Shift-Y. Oh, hi, Nestor. Now, if we do it again, how about folks who are working for the government? Thank you. Community organizations and industry. So as you can see, as we can all see, we have different expertise. We have advocates, scientists, product manufacturers, researchers, regulators, and that range of perspectives is a strength for the work that we are discussing here. The path to safer and more just products doesn't just belong to one group. It can only be built together. So each of you brings knowledge to others, and we are collectively bringing knowledge to each other, whether it's technical expertise or deep-rooted community insight. Everyone's contribution matters. And today is about tapping into that collective knowledge and starting a conversation that we expect to carry forward beyond this roundtable. And just to give you a little bit of that story that on how the project started, as it was mentioned, the department was inspired by a report from the NRDC and Habitable that found that equity is rarely included explicitly in alternative assessment frameworks. This was pretty much a call to action on how can we better evaluate trade-offs in a way that consider disproportionate impacts on overburdened communities. And today's roundtable is a part of a broader project, as Jen mentioned, that was supported by the US EPA Pollution Prevention Grant, with the goal of developing tools and training, such as today's video, for integrating environmental justice into the SCP alternatives analysis process. And a quick note on language here, in the SCP regulations, we use the term alternatives analysis to describe our very comprehensive process for comparing a priority product to alternatives. And while our discussion today will center on the SCP-AA framework, our hope is that key takeaways from today will extend beyond the program and inform the alternatives assessments field at large. But we might be using AA interchangeably today. And today, through this project, DTSC has partnered with UMass Lowell and UC Berkeley to evaluate environmental justice tools and apply recommendations through case studies. We've been following the steps shown on the slide, and this pretty much led us to where we're here today. We are ready to share out and receive feedback, and we will be updating our AA guidance based on these findings and conversations to better assist manufacturers and to better protect consumers. So with all this in mind, I will turn it over to my colleague, Alicia Lim, who will give us a brief overview of the SCP AA process. Alicia?
Thanks, Michelle. So starting with the big picture, let's go over the SCP process. So we often use this four-step figure to show our regulatory framework. After SCP identifies a product chemical combination that causes harm and lists it through rulemaking, it becomes a priority product. So that's the second step. And this priority product then moves to the alternatives analysis phase, or step 3. In this phase, manufacturers have to evaluate safer alternatives through our robust alternatives analysis process. And this is a key part of our program because it helps us move beyond just avoiding known chemicals of concern to products that are safer. So what exactly is alternatives analysis? We ask industry to answer these 4 key questions. Is a chemical of concern necessary? What alternatives exist out there? And what are the trade-offs for each of these alternatives? And looking at these trade-offs, ultimately, is there a safer alternative? And our goal is to avoid regrettable substitutions. To answer these questions, there are a number of factors to consider, which I'll go over in the next slide. Here is an overview of our AA process. So first, we want to identify any functional, performance, and legal requirements of the entire product. and also identify the role of the chemical of concern and determine if it's necessary in this product. Next, we want to identify and consider a broad range of alternatives and research and gather information for each of these alternatives. Then we want to identify points of comparison between the chemical of concern or product and each of these alternatives. Next, we then do the comparison and we repeat this analysis as needed when we acquire new data. And lastly, we want to select an alternative, keeping in mind, again, any potential trade-offs and support this decision with the comparative analysis from step 4. So looking more closely at that third step, we want to consider differences between the contributions of the chemical of concern or product and each of the alternatives to one or more adverse impacts across each of these life cycle segments shown here. So we want to consider everything from raw material extraction all the way through end of life, as well as consider any associated exposure pathways. And the adverse impacts to consider include human and environmental hazards, physical chemical properties, economic impacts, and performance. So going back to this work, this is research with a purpose. We want to build practical solutions that serve both industry and impacted communities. We know there are many gaps, such as gaps in data, methods, and representation, and this work is a starting point to close those gaps. And this is exploratory work, so we're not changing the DTSC regulatory alternatives analysis process, but we are adding optional tools to our AA guidance for manufacturers. And overall, we hope this informs advancements in the greater field of alternatives assessment. With all that said, let's get started. So first up, we will have Molly Jacobs, who will share recommendations for incorporating environmental justice into alternatives assessment. And a short bio for Molly. Molly is a director of applied research for the Sustainable Chemistry Catalyst, a research institute at the Lowell Center for Sustainable Production, managing the Catalyst's extensive alternative assessment and informed substitution work. Molly's research examines environmental health issues, utilizing her deep expertise on the environmental and occupational causes of cancer and asthma. She's also a member of the CTAC interest group, the Advancement and Application of Alternatives Assessment, or A4. Then we'll hear from Grace Campbell, who will walk us through methods and tools that support this work in practice. Grace is the project manager with the UC Berkeley Center for Green Chemistry. Grace has degrees in environmental engineering science and environmental health sciences from UC Berkeley. She has experience in green chemistry, research on consumer products, and community-engaged participatory research. Participatory research with populations impacted by PFAS pollution. After a short break, we'll then move into small group discussions. That's your opportunity to share what's working, where the gaps are, and what's needed next. We will have staff and researchers from DTSC, UMass Lowell, and BCGC facilitating these discussions. Thanks again for being here. Your time, attention, and insights are what will make this roundtable meaningful. Good. So now we'll move to Molly's presentation.
Great. Thank you, Alicia. Let me just, if you want to pull yours down and I'll pull mine up. Or is that Michelle? Great. Good morning, good afternoon to all of you, wherever you are. It's nice to be with you today. Yeah, I'm Molly Jacobs, again from UMass Lowell. And before I get started, I just want to acknowledge some of my collaborators on this work. So Abigail Noble, who is with us today, she'll some of you might meet her in one of the scheduled breakouts, as well as Sally Edwards and Joel Tickner. Oops. Get the arrows going. Here we go. All right. So as Alicia mentioned, UMass Lowell was contracted as part of this EPA pollution prevention grant to work with experts in this field. So both environmental justice experts as well as alternatives assessment experts to help us identify what might be some environmental justice concerns and considerations to infuse in the alternatives analysis or the alternatives assessment process. So how could we better consider environmental justice in these approaches? And the second ask of us was to review existing environmental justice tools. How are they relevant and useful to the alternatives assessment process? So that's what I'll be going over today. So this expert engagement process builds on separate work that we also conducted for the Interstate Chemicals Clearinghouse. So that guide, the Alternatives Assessment Guide the IC2 uses is kind of now infuses some environmental justice considerations into it. And we built on that effort. A key step in both of these efforts was what we thought was to establish a purpose statement for considering environmental justice in alternatives assessment. The purpose statement was informed by the definition of environmental justice as defined by the U.S. Environmental Protection Agency, and also the SCP program's working definition of environmental justice. It also draws on documents that address justice as it relates to chemical substitution and green and sustainable chemistry, including an updated version of the Louisville Charter for safer chemicals. And so how this reads, you can see it on your screen here, but including environmental justice in alternatives assessment means to ensure that the process of evaluating and identifying safer and feasible alternatives to replace toxic chemicals in specific products or processes means to authentically and meaningfully consult communities that have historically experienced environmental justice. It means to safeguard against the introduction of new or different burdens among disproportionately impacted populations. And it means to support identifying alternatives that benefit communities harmed by the chemical under assessment. So before I get into what we learned through this process, I want to highlight some high-level considerations that we heard. First, that it's important to introduce the top concept of environmental justice to our industry colleagues that are required to complete an alternatives assessment. Those of us in the environmental and public health fields are quite familiar with this concept, but those in industry, it's not so much the case. Based on conversations with companies engaged through an organization that I'm affiliated with, the Change Chemistry, environmental justice remains kind of an unknown or misunderstood term. It's often concerned with like internal diversity, equity, and inclusion initiatives. It's often just not been considered in the general business cases and practices of industry. So I think one of the things that we have to do here is to increase kind of awareness of what this actually means in practice. Second is to ensure that working populations are included in the context of environmental justice considerations. Occupational groups are often not made explicit in some environmental justice definitions. And environmental justice itself has historic roots in the geographic place, connecting communities to overburdened environmental pollution and the issues of like redlining and the siting of environmental justice communities. So it's important that we, elevate workplace in the context of environmental justice. And lastly, it's important for all of us to know that the alternatives assessment process is kind of complex and a bit burdensome. And so it's really important that we keep considerations practical. We have to allow this practice to move forward and not, again, just add more layers of complexity to an already complex and burdensome process. So what did we hear from and suggest about how to give environmental justice communities a seat at the table in terms of the alternatives assessment process? How should we operationalize this concept of authentic and meaningful engagement of those who have been historically harmed by environmental injustices? So first off is just to put a stake in the sand that environmental justice populations are interested in impacted parties to the Safer Consumer Products Program. And their lived experience can provide useful insights and input to improve the outcomes and acceptability of the results. But who should engage in the process and who should do the engaging was essentially the question that we asked during our expert kind of process of hearing from environmental justice experts as well as alternatives assessment experts. So when it comes to the Safer Consumer Products AA process, there will likely be multiple responsible entities that need to do these analyses. Imagine dozens of these being conducted. So imagine again dozens of individual companies having to consult with the same impacted populations, such as tribal nations, to get their input. This would be both redundant and overwhelming to these communities. So the idea emerged about the creation of some sort of third-party ad hoc environmental justice panel to support these processes. So also, we need to consider that supply chains, so those responsible entities that are manufacturing these products, these supply chains are global. And so it's, when we want to think about the life cycle of the product and the potential environmental justice impacts across that life cycle, it's one of having national expertise, not just expertise in California, but possibly also including kind of global human rights concerns, because environmental justice is a U.S. construct, right? But it infers and it is applicable to kind of human rights violations and abuses on an international level. And so including that kind of representation in this panel would be important. And lastly, because of the historical distrust of both government and industry actors by environmental justice communities, it's important that this panel not be coordinated by responsible entities or DTSC, but rather facilitated by a third and neutral party. Oh, excuse me here as I forward us along. So the second concept that we sought to operationalize was, what considerations need to be in place to safeguard against the introduction of new or different burdens among those disproportionately impacted already. So in alternatives assessment or alternatives analyses, we often examine the hazard attributes of chemicals. When we as scientists say a chemical is a carcinogen, we're naming a hazard property. But when environmental justice communities hear that, they don't think about toxicological categories. They think about their neighbors with cancer, their children with asthma, their neighbors experiencing a cluster of birth defects. So hazard is the scientific warning, but health outcomes are the lived realities of those communities. Both matter, but if we want to build trust in this process, we need to connect these dots. So when we consider environmental injustices in alternatives assessment, we need to connect health concerns with hazard attributes across the product life cycle that contain the chemical of concern that we're wanting to substitute. Environmental justice health concerns give the hazard profile of alternative in comparison to that priority product. So when we are, so what are the process chemistries that that are needed to be manufactured, and do those pose problems to environmental justice populations? We need to ask, what are those health concerns, and connect it back to the hazard attributes that actually might get analyzed in the assessment itself. And as we'll hear in Grace's talk, trying to think about the life cycle, so thinking about upstream as well as downstream, is going to be particularly challenging, in part because the REs often don't know where their products are disposed of and look at environmental justice impacts at that level, or even what the ingredients are that source their alternatives. The geographic locations might be difficult to find, right? So some of this is going to be quite challenging to operationalize in practice. So a primary principle in alternatives assessment is to select alternatives where hazards are reduced. However, we do not have a substantial inventory of chemicals and materials that are inherently benign by design. We typically find alternatives that are safer, but not safe. So we're moving towards safer, but sometimes hazards will persist. And so once we've assessed alternatives that are, and I've identified those that are indeed safer, we need to ask whether there are exposure disparities such that those residual hazards will be problematic to environmental justice populations. So will environmental justice populations continue to bear disproportionate burdens, either at the point of use of the product or considering, again, this upstream or downstream impacts? So a classic example that we've described is the case of, for example, a cleaning product that has endocrine activity and associated with reproductive impacts. So if the alternative of interest lacks these hazards, but is a respiratory irritant that could exacerbate asthma, is that appropriate for a cleaning product where janitorial workers who are already experiencing high prevalence of asthma, is that an appropriate alternative? Or is there another that we can find that, again, doesn't shift these burdens to to those that are most impacted? So lastly, we explored the concept of environmental, it was to operationalize this issue of benefits, right? Like an alternative is not sufficient if it doesn't benefit those that have been harmed by the injustices of the chemical of concern. So safer alternatives, we kind of learned and conversation, will be a benefit to environmental justice populations if they are safer, right? This transition to safer is a huge gain for everyone, including environmental justice populations. Yet a bigger question is whether or not these communities are going to have access to these benefits. Great, it's safer. It's not helpful if I can't access that product. So alternative, and if it's affordable. So alternative assessment takes on the affordability question as costs are examined in the process. Not often from the consumer perspective, they're often analyzed from the manufacturer perspective, but that can evolve. What's more challenging is the issue of access. Most of who we talked with, as well as our own expertise in the field of alternatives assessment, thinks that the issue of access is a bit beyond the alternatives assessment process. We need other levers. We'll need policy and programmatic levers to make sure that alternatives that are safer are made accessible to those populations are already, overburdened by injustices. So now I want to move to the issue of the analysis of environmental justice tools. As a reminder, we were asked to explore the relevance and utility of existing environmental justice tools to support the alternatives assessment process. We identified dozens of such tools. The majority of these tools are actually at the state level, but for our review, we selected 9 tools that we thought were representative of the different types. So, for example, we reviewed the Cal EnviroScreen in California, an example of one of these state level tools. We reviewed national tools, including the really seminal tool, the EJ screen that was developed by EPA, and also those with a more public health focus, such as the EJ dashboard that was developed by CDC. We also reviewed tools that had a more enhanced ability to look at specific substances, such as the toxic release inventories, toxic tracker, and also the pollution prevention EJ facility mapping tool. And lastly, we looked at tools that were more globally available as a resource. Again, we could only, because of this nature of global supply chains, but we could only find one of these, which is the social hotspot database. So we assessed these tools by examining 8 chemicals of concern that were kind of grounded in what SCP's priority products, one of the priority products that were up for regulation. And we considered specific alternatives that were elevated in the program's priority product profiles. So we looked at those alternatives and also that chemical of concern against a number of questions and criteria that we establish relevant to alternatives assessments. So for example, we asked, could these tools identify specific hazard traits that should be prioritized in the alternatives assessment from an environmental justice perspective? Could they help identify disproportionate exposures related to hazardous emissions or support identifying exposure trade-offs? And could they be used to identify environmental justice and human rights hotspots, either upstream or downstream of the product, including those outside of the United States? Again, considering that products are global. We have global supply chains. So at its core, alternatives assessment is a process of seeking safer alternatives. And of the 9 tools that we reviewed, really none of them are very good to support alternatives assessment. The major limitations that we found, for example, is their limited capacity to examine occupational impacts. Again, most of these tools, as many probably in the audience are familiar with, they're geographically based. They're interested in impacts, for example, at a census tract level, not necessarily within a given facility. We saw that there's kind of minimal hazard or health outcomes that are available to incorporate in the tool. A lot of our hazard tools have like up to 18 different hazard traits. Most of these tools look at a set of health concerns or outcomes that I can count on one hand: cancer, asthma, cardiovascular disease, common public health concerns, but not necessarily the array of hazard traits that we look at when we consider alternatives. That again, these tools hinge on knowing a facility's location, which might be, easy to do for a responsible entity because they know their protection sites, but they don't know the sites of where things are disposed, and they don't necessarily know the sites of where their supplier products are coming from. So this makes kind of the overall assessment a bit difficult to do. And again, the tools kind of fall short when we're looking at locations outside of the United States. These tools were, developed for environmental justice issues in the US, not globally. So again, they're difficult when we're trying to hold this life cycle perspective and conducting the assessment itself. And lastly, their utilities relating to specific chemistry is quite limited. Most of these tools are addressing highly regulated chemicals because of their concerns. We lack that kind of information on these newer chemistries, right, that are kind of under the radar with regard to regulation, in part because they're new. And so we're not kind of capturing all of that. What was useful in these tools, however, is that they provide basic insights of environmental justice impacts by geographic location in U.S. Manufacturing, that you can kind of co-locate with a manufacturing facility in the United States. So what we kind of determined is that they're really useful in helping our responsible entities understand the environmental justice impacts around their facility, right? This can help establish the baseline that's important for the comparison of alternatives going forward, but they're not helpful in addressing the actual alternatives themselves, again, unless you know the facilities of where these things are being produced. So moving forward, as Jen mentioned in her introduction, the elephant in the living room here is that environmental justice initiatives in this country are under attack. And some of the tools that we reviewed last year in support of this grant from EPA are no longer even available. So the EJ screen has been taken offline. The climate and environmental justice screening tool has been taken offline. There's some that were taken offline but put back up based on court order, like those managed by CDC. But the underlying data going forward is questionable, and so moving forward, it's unclear whether or not these tools can be maintained. We looked at a lot of the state tools and what was the status of the state's tools. California is still robust. Several states have taken them down. So there is going to be this availability concern going forward. So what does this mean for kind of elevating environmental justice concerns going forward? I think first and foremost, we really still are at a state of awareness and building awareness of environmental justice impacts among responsible entities. Because of this issue with the tools, I think that we're going to have to deal with a lot more qualitative information and not to underestimate its importance. We have incredible knowledge, lived knowledge and experience that can be offered to this alternatives assessment process by environmental justice populations. And also, it's an awareness that we need to build resources to build tools that support this process. The existing tools weren't designed for AA, but that doesn't mean going forward, we can't build better tools to support the process. And with that, I'll turn it back to my DTSC friends. Thank you.
Thank you, Molly. I don't see any questions in the Q&A. So we can transition to Grace. I'll hand it over to you. And as a reminder, after Grace's presentation, we will transition to a break and then breakout rooms. So feel free to utilize the Q&A for any clarifying questions from any of the presentations so far. Take it away, Grace.
All right, good morning and good afternoon to you all. Let me just pull up my slides. All right, hopefully you all can hear me and you can see my slides. And as a reminder, my name is Grace and I am the BCGC program manager that was contracted by SEP for this grant. And today I'll be presenting methods for incorporating environmental justice in alternatives assessments, lessons learned from case studies. So just to reiterate, today I'll be presenting on that second phase of SEP's EPA Pollution Prevention Grant, which is kind of this application portion where we took the recommendations and considerations provided by UMass Lowell, which Molly just presented on, and applied them to 2 case studies to try and identify potential methods to evaluate environmental justice in the assessment of alternatives to harmful chemicals in consumer products. I also want to provide some context regarding EJ and how SEP intends to incorporate EJ into their program. So environmental justice generally champions that notion. I know we've discussed this in the presentation so far, but the notion that all people, inclusive of race, culture, national origin, and economic background, deserve a healthy and safe environment. So SEP has laid out their own initiative to incorporate the concept of EJ into their program, which includes reducing harmful impacts of products for the most vulnerable, honoring the voices and lived experiences of people in frontline communities, and understanding the histories that have led to these injustices, provide opportunities for people who have been left out to contribute to their work, and making sure that the benefits of the program are fairly distributed and extended to all forms of life. So the goal of this project as part of the grant is to consider these tenets of SEP's Environmental Justice Initiative in conjunction with UMass Lowell's recommendations and create actionable methods to evaluate and consider environmental justice in an alternatives assessment. So in order to do this, I evaluated potential methods using 2 case studies. The first case study I looked at was triphenyl phosphate, or TPHB, used as a plasticizer in nail products. This was a smaller focused case study with the goal of infusing EJ when comparing the hazard concerns of the incumbent chemical of concern and potential alternatives, better known as a hazard assessment. I looked at 4 alternatives which were identified from a report written by SEP on TPHP and nail products. And then the second case study was looking at PFAS used as a surfactant in floor polishes. And this was a larger case study considering environmental justice throughout the alternatives assessment process, comparing PFAS to 2 alternatives. We identified these alternatives through a report written by students during that Greener Solutions course that Megan had mentioned previously. So how did we choose these case studies? We chose them based off certain criteria. For one, that there was previous work available that assesses the products containing these specific chemicals. And I'm going to commonly refer to these product chemical combinations. So this TPHP in nail products and PFAS in floor polishes. Also, whether 2 or more commercially available alternatives exist with similar technical performance to the incumbent chemical and seemingly lower hazard. Also, in our initial screening, we were able to identify unique populations along the life cycle that experience disproportionate exposure to these product chemical combinations. And finally, we chose case studies where the product chemical combination was in some stage of SEP potential regulation, such that the findings of these case studies could help inform future regulation. So to clarify, SEP is considering both TPHP in nail products and PFAS in floor polishes, and they're in some stage of regulation. And also that BCGC student group wrote an extensive report evaluating those 2 alternatives to PFAS and floor polishes, which informed much of the necessary context to select that case study. So where did I specifically investigate EJ in the alternatives assessment process? So I considered how to incorporate environmental justice into life cycle thinking, the use of community engagement, infusing EJ into hazard assessment, applying EJ tools to quantify community impact. Then after applying these methods, we identified where EJ evaluation methods may be most suited to populations along the life cycle, but also where information collection strategies may be most applicable throughout the life cycle. So today, FYI, I'll be presenting from both case studies kind of interchangeably. So what is life cycle thinking? So oftentimes we think about when we think about a consumer product, we often think about when that product is being actively used for its intended purpose by the consumer, like cleaning your face with a face wash, sitting on your couch when you're watching TV, or painting your walls with a new fresh coat of paint. And this is often really important when considering exposure of chemicals used in consumer products, because users often have a direct exposure to these products. So applying a lotion to your skin every day, but also repeat exposure. So applying that lotion to your skin every day. However, there's many steps before and after use where people can be exposed to either the product itself or the materials associated with creating or disposing of that product. These stages outside of use can even be the justification for the removal of certain chemicals in consumer products. So for example, there's a chemical used in tires known as 6-PPD, and 6-PPD can react in the environment into another chemical known as 6-PPD quinone, which is highly toxic to salmon, and in turn has had significant impacts to Native American tribes and nations, as salmon is an important food source and culturally significant. So SEP has even pursued regulation of 6-PPD in tires based in part on that downstream impact. So We use life cycle thinking and alternatives assessment to better ensure that there's no unintended upstream or downstream impacts associated with the selected alternative, meaning no regrettable or haphazard substitutions. So we took this concept of life cycle thinking and used it to get a better sense of the scope and impact of the priority products we looked at. We drew up a life cycle model for PFAS and floor polishes and found that it could be used to identify disproportionately impacted populations exposed to relevant chemicals like precursors and byproducts upstream of use and degradation products downstream of use associated with that incumbent chemical of concern and its alternatives. Also, we considered which information collection strategies to pursue for each population. So we identified populations that could benefit from community engagement or increased research, and also those location-specific populations where EJ tools could be applied. And finally, we also were able to identify exposure scenarios and physicochemical properties to inform exposure assessments for these populations. Here is an example of how of our life cycle model where we identified impacted or EJ populations. So for our model, we identified workers involved in the manufacturing of the relevant chemicals, materials, or the product itself. Fence line communities nearby any manufacturing or disposal facility leveraged throughout the life cycle. And in the use phase, janitors who apply floor polishes and the general public who spend time in locations that use these industry-grade floor polishes that contain PFAS, like grocery stores, hospitals, and laboratories. So we laid out this kind of high-level map of how we might identify potentially exposed populations, but I also want to note that in this phase, we're also interested in considering more specific guiding questions to better understand these populations and their specific experiences. So following that first step, where I identified communities and other relevant information through life cycle thinking, I then sought out community representatives and engagement experts from those identified priority populations. So for this work, I conducted 5 short interviews with 1 nail salon worker representative, 2 janitor union organizers, occupational health researchers, and 1 community engagement expert who partners with PFAS impacted communities. The goal was to gather relevant information that may impact the adoption of a greener alternative, but also to identify best practices for engaging with specific communities. So some information on what we might be able to gather from these interviews. So first, we found that community engagement could help identify priority health concerns that could impact alternative selection. So for example, from these interviews, I learned that nail salon workers and janitors were most concerned about more immediately felt or noticeable health impacts like coughing or sneezing, rashes to the skin, or eye irritation, whereas those long-term health impacts were not top of mind. And in the interviews, we kind of discussed reasons why this might be the case. And I think for one, it's totally understandable that the more immediate concerns may be present on the mind, including not only those short-term health impacts, but also concerns about completing all your responsibilities for that week or making sure that you can provide for yourself or your loved ones. That might just make those more long-term health impacts that might be felt decades later, maybe just back to the mind. Also, I think that it might be difficult to link workplace exposure to chronic health impacts, and some reasons include that similarly exposed individuals may not experience the same health impacts, and levels of exposure in occupational settings are often varied and unmeasured. So additionally, we learned about what exposure scenarios may be missed in the literature or other sources commonly leveraged in an AA process. So, for example, when we asked in what scenarios janitors may be most exposed to floor polishes, one interviewee highlighted preparing, stirring, and transferring as additional scenarios for the janitor exposure model that I originally extracted from the literature. So just to clarify, I initially designed this janitor exposure model using information reported in a paper looking at PFAS exposure from our particulate matter emissions during the floor waxing process. So based on the focus of that paper, this model mostly prioritizes exposure experienced through inhalation or breathing of that fumes or those emissions. However, I added preparing, stirring, and transferring of floor polishes to the exposure model based on the information shared in that in the interview. And I think that these additional mechanisms of exposure kind of help us holistically understand exposure and kind of include more scenarios that may be relevant to dermal exposure. I was also able to identify additional information outside of exposure and hazard from these interviews that could impact the adoption of safer chemicals. So, for example, I learned that for nail salon workers, community knowledge and social networks are important in the transfer of information and adoption of certain products. So, if a safer alternative is on the market, but the larger network isn't discussing that product, or the conversation's largely negative, then that product may not be adopted. And I think another important example is the importance of technical performance for nail salon workers. So I learned that for nail salon workers, we'll often prefer products that dry faster, last longer, or look better for increased customer satisfaction. So I think it's important to consider technical performance in the selection of safer alternatives if we truly want to get at the priorities of the nail salon worker population, and also if we want this alternative to be accepted. And finally, from these interviews, I learned that systemic factors such as health science literacy or economic pressures could impact the degree of exposure and health impacts. So, for example, in the context of health science literacy, nail salon workers and janitors just may not be aware of the link between chemical exposure in the workplace and long-term health impacts, especially if these impacts are felt decades later. Another example is workplace performance pressures. Janitors may use more of a product, especially if that product is perceived as green, if they think that using more would increase the performance of the product, thus likely increasing their exposure. Also, in some instances, janitors may bring products from home in place of green products provided at work sites. So in addition to this kind of data we could identify from these interviews, I also learned many things as far as implementation. First, I found that these short interviews were an efficient use of resources as we're able to gain the perspective from individuals with lived experiences or years of expertise, which are often difficult to recreate with secondary research, and the points brought up in the interviews may not be commonly found in sources commonly leveraged in an AA. However, I think it's important to note that time and resources are needed to identify interviewees with both good information and population coverage. Also, I had a difficult time accessing manufacturing populations. However, in future AAs, the practitioner may be able to access this population through other networks, such as the product manufacturer's contacts, which we didn't have access to in this case study example. And finally, most interviewees recommended that a third party with ample engagement experience with that specific population complete these efforts in place of the product manufacturer who is currently tasked with completing the AA and SEP regulation. Some examples provided were consulting firms with a community engagement wing, community-based organizations, or university researchers who are known to and have positive relationships with specific communities. So, following that community engagement step, we then analyze the application of environmental justice and hazard assessment, specifically looking at two methods. So the first method was a comparative hazard table, which presents hazard rankings for specified endpoints for each evaluated chemicals and roll-up hazard scores, which presents hazard rankings, which aggregates those hazard rankings by endpoints into one metric to compare chemicals. We incorporated environmental justice considerations by building the hazard assessment around one specific priority population. Also by adding population-specific exposure considerations like demographics and exposure route potentials to the hazard table. And then also by emphasizing hazard endpoints identified as highly relevant to the priority population in both the table and roll-up hazard score. In the second method, I used something that I'm calling a life cycle hazard assessment. This method considers the general hazard impact for populations potentially exposed along the life cycle. Specifically, I generated single hazard scores for relevant chemicals at all life cycle segments, and then averaged those hazards among chemicals by each segment, and then identified priority populations potentially exposed at each stage. So here's a simplified version of the hazard table that I looked at, where I developed for TPHP and alternatives in nail products, specifically prioritizing nail salon workers. So for each evaluated chemical, so here we have TPHP and two alternatives, I emphasized priority endpoints and then added additional population exposure considerations to help contextualize that hazard. And here's a list of the priority endpoints that we identified for nail salon workers. We translated the concerns brought up in the interviews, which happened to flag these more immediately felt endpoints. And then in a literature review, we identified additional endpoints from academic papers that either demonstrated the presence of other chemicals and nail salon products associated with that same endpoint, leading to cumulative risk for that health concern. Also, whether a paper found an association between nail salon work and that specific endpoint. And finally, if it performed interviews with nail salon workers that identified that endpoint as especially concerning to them. So we combined these endpoints from the interview and the literature with the goal of fusing together both the priorities of nail salon workers, but also endpoints of high concern from a public health perspective, which kind of includes these chronic endpoints. So following the hazard table, we then generated roll-up hazard scores using the multi-attribute utility theory method, and then weighed priority endpoints more heavily in order to better understand cumulative hazard impact for one priority population. So to go from these hazard rankings, so these medium, high, low data gap rankings by endpoint, to a single score, I converted these values into values between 0 and 1, then multiplied them by weights based on whether or not those endpoints were identified as priorities, then summed across endpoints for each chemical, creating a final roll-up hazard score between 0 and 1, So this chemical with the score closer to 1 was the best scoring chemical, meaning it had the lowest hazard. So here is the resulting roll-up hazard scores from the example that we just provided, and the lighter blue scores are weighting all endpoints the same versus the darker blue is weighting priority endpoints 2 times the other endpoints. So while in this example, the best scoring chemical was consistent irrespective of weighting scheme, I do want to note that the scoring and results are very contingent on the available data you have, how you handle data gaps, the number of chemicals in your comparison, which endpoints were identified as priorities, and the selected weighting scheme and scoring method. So in some scenarios, the endpoint weighting may have significant impact on chemical selection based off the unique combination of all these factors. In the second method, I created single hazard scores using green screen's benchmark methodology for chemicals present at each life cycle segment for the incumbent chemical and its alternatives. So in this example, we have 3 chemicals present when creating a PFAS alternative we evaluated called SLG. And these chemicals may be present or may be exposing populations at the chemical synthesis stage. Along with these average hazard scores, we reported hazard concerns sourced from the Pharos database. So once we generated those scores by chemical, we averaged the scores by each segment to identify where hazard might be present and listed those priority populations exposed along the life cycle next to those average hazard scores. So here's a comparison of average hazard by life cycle segment for PFAS and that alternative SLG. We see that PFAS consistently underperformed as compared to SLG. Also, we might be interested in evaluating the impacts of chemicals associated with SLG synthesis on worker populations present at this phase and fenceline communities living near the surfactant synthesis site, given that it has a lower average hazard scores for the relevant chemicals at that step as compared to the other steps. So some takeaways when applying these methods. We learned that there's no perfect or general applicable method for creating those kind of single hazard scores that we generated in the first method. And I think that inherently all scoring methods kind of have some form of bias and limitations. Instead, it might be worthwhile to try multiple weighting schemes and reporting on differences between weighting priority endpoints versus no difference weighting. And finally, I also do believe that potentially this comparative hazard table for one priority population that is especially exposed to the product chemical combination and identifying average hazard by life cycle segment provides overall good hazard coverage of the chemicals present and populations impacted throughout the life cycle. So moving on to our third section of our findings, where we looked at ways to implement EJ tools into the AA process. So as a reminder, as Molly mentioned, we evaluated or we took the 9 tools that were evaluated in the first stage of this grant, but we added the EPA's Echo Facility database to that list. And we evaluated the tools on whether they provided information that could be relevant to an AA. Specifically, we considered whether they provided EJ indicators for specific locations, chemical release transfer information for specific facilities, and reported facility chemical release violations. Ultimately, we selected a combination of EJ screen, the Easy RSEI dashboard, and the Echo facility database to select this relevant baseline information from. So after identifying what information may be useful from EJ tools for an AA, we created instructions to populate something we're calling a facility report, which extracted facility location information, relevant chemical releases from the facility of interest, relevant chemical waste transfers to secondary locations to kind of consider that downstream impact of chemical production or facility statute violations, and EJ indicators on exposure, health, and SES information for areas within a 1 mile radius of the facility of interest. We apply these instructions to a PFAS manufacturer and an alternative manufacturer known to supply surfactants for floor polishes. So here's an example of how we might use the information extracted from EJ tools in an AA. Here I'm comparing EJ data for communities surrounding two manufacturers I mentioned, so that PFAS manufacturer and that alternative. We see that there are releases and transfers of chemicals relevant to the production of PFAS, along with relevant violations or release violations and elevated values for exposure and health indicators for the community surrounding the PFAS manufacturer as compared to the alternative. Given this information, my thought is that we may be further burdening an already burdened population by using the surfactants produced at this site, meaning that we may want to opt for an alternative. So some takeaways from applying these EJ screening tools were that we learned that these tools are only applicable to communities surrounding point locations like chemical or product manufacturing facilities. However, these tools cannot be applied to populations widely dispersed, like janitors who work at many sites across the state. And also, we cannot translate this community level information to workers present at that specific point location or facility. However, when applied to the appropriate community, EJ tool results can be used to compare baseline information for location-specific communities that differ with alternative selection. Additionally, I think it's really important to note that these tools were just not built for AA. And one big limitation is that the information provided by these tools cannot be definitively associated with the chemicals used in specific products. And finally, 3 federal tools out of the 9 tools that we looked at are no longer available. As Molly mentioned, copies of 2 of those tools are currently available, but they're not being updated, including EJ Screen, which in the middle of this work, we had to switch to the copy when it was taken offline. So after developing these methods, we decided to synthesize all our findings and create a model to help future users identify where it might be best to apply these methods or identify what sources might be most useful when evaluating the impacts of a certain population. I don't expect anybody to be able to absorb this entire flowchart, but essentially what we did is we revisited our life cycle segment model where we identified potentially impacted communities and then considered which information sources could be most applicable to each population. We ultimately identified EJ tools, community engagement, pre-written resources from various organizations, and literature review as potential sources. So here's an example of how we might use the flowchart. So in the product use segment, we identified nail salon workers as a worker population meaningfully exposed to the product chemical combination due to their elevated risk of exposure for when applying nail products. Additionally, the SCP TPHP profile notes that nail salon workers in California are predominantly low income, non-native English speaking women of childbearing age and may experience other environmental and socioeconomic stressors that can act cumulatively to affect their health. We found community engagement and literature review to be effective tactics, and we just didn't follow through on pre-written resources because we felt that the two sources provided enough information for this case study. And we identified an interviewee contact through SCP's network. As you can see here, we didn't apply EJ tools to this as an evaluation strategy because in this use phase, it's commonly distributed across many locations. So some kind of overarching takeaways from considering best information collection strategies are that first, we found that the chemical and product manufacturing populations may be difficult to access in future AAs as so in and this might be the case because EJ tools cannot be applied because they currently provide just community level information that cannot be translated to the occupational experience, and potentially resources on specific manufacturing populations at a specific site may be limited. Also, we had a difficult time accessing populations exposed at the end of life disposal phase. These populations are often widely dispersed and not joined by specific characteristics, making community engagement and finding resources on those specific populations difficult. And finally, each product chemical combination is unique, and the data collection method identified as applicable to one life cycle segment may be transferable to another, given the unique interactions between the population and the product. So for example, we didn't apply EJ tools in the use phase. However, there may be unique products that where EJ tools could be applied at that phase. So finally, to wrap up, we also identified potential opportunities to refine and improve these methods. For one, we could build out from that hazard scoring method we presented and create some kind of risk score by adding that population-specific exposure information into the scores calculations. Also, a new EJ screening tool could be developed, which could take many forms, and a EJ screening tool specifically for AA. Also, another key consideration is how do you compare results from these methods and these methods as compared to other AA methods, especially when they diverge, by maybe making use of some kind of weighting or summary or applying other multi-criteria decision analysis methods. And finally, we didn't touch on this in this presentation, but pursuing ways to evaluate EJ considerations in both economic analysis and health burdens estimates. Thank you so much. I know I presented on a lot of information today, so I really appreciate your attention, and I'm really excited to hear the feedback and questions in the discussion or in the roundtable, or sorry, the breakout rooms. And with that, I'll kick it to Kim if we're doing Q&A.
Great, thanks so much, Grace and everyone. I don't see any questions in the Q&A. The roundtable discussion rooms will not be recorded, or if they are recorded, we will remove them from any postings. But we will be taking notes. We will have a facilitator and a note taker in each breakout room. I'll go ahead and put in the the breakdown for the rest. And I see that we do have a question from Tom Lewandowski. Grace, can you talk a bit about the time required to do the interviews?
Yeah, that's a really good question. Trying to think about how the time, like my time was broken down when we were doing the interviews, because I think it was a lot of collaboration with the SCP team on identifying really good interviewees, and also just kind of getting feedback on SCP, like suggested contacts. So I think that collaboration would be really important in identifying interviews. And then I created a script with 5 questions. And the goal was to specifically identify priority health concerns, priority exposure routes, other considerations, and then in terms of this project, what are recommendations for engaging with those populations? So that was kind of a question that you wouldn't ask in the interview, I guess. But the interviews kind of, once I got like the hang of it, were 30 minutes and they were really informative. And then I think that something that's important to think about is having both an interviewee but also a note taker, because I was trying to write my notes while asking questions. And so I guess some of the time that would be necessary is also translating your results and your kind of feedback. And then also making sure that interviewees could review the information they shared to make sure that you're kind of extracting the right concepts that were brought up. Hopefully that makes sense if that gets to your question.
Tom, feel free to raise your hand or put in the chat if you have more follow-up specific questions. We have oh yeah, go ahead, Tom. Let me see. I can ask you to unmute.
Yeah, okay, that's great. Yeah, I mean, I was just curious to know, so you can hear me, yeah?
Mm-hmm.
Great. I mean, because I know that, with at least the current SCP process, there are some strict timelines, right? So like 6 months to do the stage 1AA. And so I'm just trying to get a sense of like how much time it took to sort of identify who you're going to interview and then schedule the interviews, which I know can be challenging, do the interviews, and then analyze the data from the interviews. Like it seems like that that might have been a fairly time consuming process. So just, you kind of, you talked a little bit about like the time of the interviews, right? But like overall, what was kind of the amount of time to kind of go through that whole process? Roughly.
Right. That's a good question. I do think maybe on the order of like 2 months, but I think what I think would be the biggest um limitation is just finding interviewees that are going to help you like get to those questions and are engaged. So I do think that like collaborating with people to kind of find interviewees it would be pretty useful. But I guess I would say on the order of like maybe 2 months to fulfill that process. But I know that we've also discussed where you might want to do this in the AA process. And I think we've also mentioned like repeat kind of or engaging with the community at multiple stages of the AA, which I don't know how. I'm trying to remember the timeline for that, but I guess it could also just be outside of that 6 months. You can also continually kind of gain feedback through those interviews.
Oh, Tom, you were muted for that last bit.
Yeah, sorry. Yeah, thanks. That's helpful. And also wanted to say nice talk.
Thank you.
I think we can sneak in one more question. We have a general question about for TPHP in nail products, how long was the entire process to get the priority product listing going? Cheyenne, do you want to address that?
Yes, I can chime in. And so for the general regulatory process in SCP, like when we do the priority product and chemical combination research, and it usually takes like 1 to 3 years, I would say. And then because during the course, we also need to like incorporate some feedback from the interest parties and to get their perspective and have some like a public comment period. Then once it get into the rulemaking process, it's another generally like 1 year. And after that get into effective, then the manufacturers need to do the notification and the two-stage alternatives analysis. Then that typically takes, I would say like 1 to 3 years. Depends on how like complex of that product is and how like how manufacturers choose which paths they're gonna go through, like whether there's available existing feasible alternatives. So it's all depends on like different situations. So for the TPHP in nail products, because we also built into some threshold for the alternative analysis. And so at this stage, I think we don't really expect there's a alternative analysis will submit it. But right now we are still in that final stage of the rulemaking package public comment period. So we'll see.
Great. All right. With that, let's transition into a break. Let's go ahead and have folks reconvene by 10:40 Pacific time, if possible. And we will go ahead and shuffle people into breakout rooms when we return. So 10:40, we will put that on the screen, and please enjoy a break. Thanks, everyone.